All or nothing. Real beauty exposed. Hi, and welcome to another episode of the All or Nothing podcast. I'm Dr. Heather Anderson, and today we're going to talk about why people go too far with cosmetic treatments. Now, we've all seen those people out and about. They're in the media, they're on social media. There's sometimes people you see walking down the street. They've had too much cosmetic work done. And we always sort of look at them and go, why? Why would someone allow themselves to look that way? They've gone past what we call the aesthetic endpoint. And that is basically where you have treatments that maximize the way you look as your natural identity, but they start to go too far past that where you start to look a bit weird. And that's a really sad thing, and it is a constant driver of fear for people having cosmetic treatments, because naturally you don't want to look like you're not yourself. So why do people go too far? Why would someone look in the mirror and go, yep, I want more of that? So let's unpack why that actually is. Now, there's a bit of psychology behind that, in that people, when they have treatments, they often feel really good. So whether or not they bring low self-worth to the table, such as the stuff we talked about in episode 1, or whether or not they're just trying to tweak something small or try and fight the signs of aging. When they sort of start doing that, it can actually lead to them having what we call a dopamine release. So dopamine acts as a neurotransmitter and a hormone in our bodies where we have a reward cycle. When we have this reward cycle happen, we start to feel really good and it makes us want to do it again. It's kind of how addiction works, I guess, where people might gamble, they might do drugs, they might drink alcohol, they might have sugary foods. You get this real high spike of dopamine, which makes you feel really good in the moment, and then you have a crash of it. So a really good analogy is, high GI versus low GI foods. So refined sugars, like, you go get your McDonald's, you're going to have a spike of your blood sugar, and then you're going to have a crash afterwards. But then you're going to crave something afterwards. You're going to start craving that sugary stuff again, because that's how our brain and body works. Whereas if you have low GI foods, like that grainy toast or something like that, it might not give you that high. It might not mentally feel as good when you have it, but it keeps you sustained for longer. So you're not going to have that crash. Long term, that's better for you, but in the moment, it doesn't feel as good. Kind of like cosmetic treatments. So this doesn't happen to everyone, but to people who are wired that way more, or to people that perhaps have a little bit more vulnerability, it can happen to them, and that can lead them to wanting more. When you want more, you start to have a skewed perception of why you want more. You're just really craving it. It's kind of like if someone has an addiction to, say, gambling, they obviously don't go into it going, I know this is bad for me, but I'm going to do it anyway. They go into it thinking they're going to win. They go into it thinking they're going to get a reward. They go into it and sacrifice a lot of their life and a lot of their savings and any other access they have to money in order to be able to get that reward. So it's really important that those sorts of people are picked up in any practice to make sure that is that actually what's driving them having too many treatments. So one treatment can turn into another, and it becomes a slippery slope for people, and then it can become dangerous for people as well. In addition to that, the people who tend to have too much work, or too many treatments tend to also be the sort of people that want control. So, humans generally do like to control things, and some people more than others. And when you feel like you lack control in your life, and particularly we all feel like we lack control with aging because we can't slow down the clock and we certainly can't stop it, it can be a bit scary to have that lack of control. So cosmetic treatments gives us that power. We feel like it gives us that sense of control. So if we're wanting that control and we're being able to do something about it, it makes us feel like we're achieving something. And that also gives you a release of dopamine as well. So it's kind of this vicious cycle that people can get into without realizing that it's not serving them. You throw in a bit of social media, filters, people getting work done that makes them look good in pictures, but not so good in reality. That also adds to it, because the social media machine means people will like pictures. They might, give them that positive feedback, that external validation that they're seeking, which again goes back to low self-worth, as we discussed in episode 1. They just go on this kind of, path where they essentially don't realize that it's not serving them. But they're getting that reinforcement, so it's telling them that they're doing the right thing. They might not be in a circle of friends or people who are holding them accountable. And more importantly, they're not with an injector who is looking at them objectively. So as an injector, it is a responsibility to see people objectively, take photos, give them time between treatments, and give them some stand down period, like what we call a cooling off period, before they go through anything that may be changing their appearance. It can be very confronting when people have their appearance change, and certainly people have to have their eye and brain adjust to it. But if people are sort of seeking too much and putting pressure on injectors, it can be quite hard for the injector too to say no. So when we look at, really famous celebrities who have bad work done, it's quite shocking to us to think that these people have access to so much money, so many resources. How is it that they look really weird? They're constantly in front of, the camera, and people are obviously critiquing the fact they've had too much work done. Surely they have someone in their team who's going to tell them, maybe you should stop. But the reality is that doesn't necessarily happen. It can be quite confronting for an injector, say, having someone like Kim Kardashian walk into their clinic and say, I want more lips. And, her lips are already quite big. So why should she have more? So as an injector, are you going to have the confidence to tell her, well, I don't think you need bigger lips, Kim? And then if that's the case, are you going to annoy her? Are you going to piss her off so that she's never going to come back and she's going to tell all of her very influential friends and connections that you're the worst person that she's ever met? There's a risk of that for sure. But being able to walk through that risk means that you're holding yourself to a high ethical standard and you're putting the patient first. So I would like to think that I would say no in that, because it's not going to serve that person. And I would also like to think that people would appreciate me being honest with them and saying, look, that's not really something that would benefit you right now, but this is what we could do instead. Or I really think you look fantastic. Maybe we should wait a little bit. Or maybe we should dissolve some filler that you've got. So filler generally, or most of the fillers on the market, are hyaluronic acid fillers. So that means that they're reversible because they can be dissolved with something called hyaluronidase. When they can be dissolved with that, it means that we can kind of wipe the slate clean and start again. It's happened with celebrities such as Lindsay Lohan. She was very famous for having bad work done in her 20s and now looks fantastic. Demi Moore, she's a little bit older, but she also went through a period of having some bad work done too. When she had someone dissolve and start again, now she looks fantastic. It's highlighting her natural features. She's looking fantastic for her age, and everyone raves about how wonderful she looks. But that's someone who's going to look at her with a very objective eye and say, I can do it better, or this could be done better. Another way for an injector to be able to really look at it in that objective way is to take really good, high-quality clinical photography. So photos that are really showing people at the right angles, very objectively in good lighting, that this is what they look like. So that cooling off period before having filler, say, which is one of the treatments that, does really change the appearance quite quickly and quite dramatically, you want photos and a stand-down period between the photo and the treatment for both the patient as well as the injector. The patient gets time to think about it, really think about it, and understand that it's going to change their appearance and whether or not they're happy with that. And also a period of time for the injector to really analyze those photos and go, what would look best? Because when you're talking to a patient in person, yes, you can make your treatment assessment, you can look at the anatomy, and you can sort of see what works and obviously tailor it to what they're concerned about as well. But ultimately, when you see people on their photos, they do look a little bit different. That's why photos are also a powerful way of kind of showing people that have had work done that actually looks really good, that it does look good. Because sometimes people can have work done and find it really confronting seeing themselves in a different light. And seeing it in that objective light on photos completely changes the perception that, oh my gosh, my lips feel massive now, but they actually look really good. And that's actually quite a subtle result. So it's a mismatch between patient and injector as well, which leads to people having too much work done. It's about confidence as an injector to say no. And if that person walks out of your clinic and never sees you again, know in your heart that they weren't the patient for you. And that's a good thing. I also work in the emergency department, and I frequently, I piss off people to advocate for patients. I'm okay to do that, and I will always be okay to do that, because I think it's really important that as doctors, and of course as any healthcare professional, we put patients first and we treat them exactly how we want to be treated. So if that means that you have to get advice or support or help from other clinicians, if that means you have to say no to people, if that means you have to tell people that this is my recommended treatment plan, and if they're saying, well, actually, I don't want to do that, that's inconvenient for me, then you say, well, okay, I'm not changing my treatment plan based on your convenience. I'm sticking to my guns because I know what's right. And you've come to see me because I'm telling you what's right, and there is a trust. So one of the biggest things that really is important in that patient-doctor relationship or injector-patient relationship is that you're really going to have that element of trust, which is an element of faith as well. But trust really is important in that the person who's with you is going to be your trusted advisor. And that's exactly what I tell my patients, that I'm your trusted advisor. I tell you what's right and wrong in terms of what I believe is going to serve you the most. And that means also saying no to treatments that, they could have some benefit, but if they don't have a profound benefit, then there's always something else that could be better. So it's about tailoring it to the person so that they really get the most out of it and bang for your buck, because cosmetic treatments aren't cheap. So you want to make sure you're getting the right things at the right time and having photos taken along the way so that you don't go too far. Along the lines of people going too far is people also having an element of what we call body dysmorphic disorder. Now, I alluded to that a little bit in episode 1, where it is a condition where people have issues with seeing parts of themselves that they feel need to be fixed or they feel are a fault, which other people don't see. So it can really spiral out of control, and it's commonly seen when people are injector hopping, so they're going to multiple clinics, they're constantly unhappy with their treatments. It's a very hard role to a very hard path to go down, and it requires psychologist input. It requires a referral to a psychologist so that someone can really get the help that they need so they get the most out of cosmetic treatments when and if they have them. Because if you treat someone with BDD and you don't recognize it, chances are they're going to complain about the work that you've done, because even though you think it looks good, they don't have that objectivity that you do. They're looking at it through a different lens. They're seeing just the fault, and they're going to find another fault if you've corrected something. So it's really important to understand that, and understand that, okay, this person may never see you again, they may get offended, whatever, but in your heart you've done the right thing. And ultimately, you'll attract the right patients because they'll be quite happy with seeing someone who's willing to kind of stand up for what is right and push people in the right direction. But it is a really hard kind of thing because, in the world of cosmetic, a lot of people have, own businesses. They want that to survive, but income should never trump integrity. If you put the right energy out there, you will definitely get the right energy back. So you don't need to be selfish or greedy or thirsty for people coming in and having treatments, regardless of whether that serves them, because ultimately, if you keep just doing the right thing, the right patients will come to you and you'll have a really harmonious, beautiful relationship. And then in your heart that you're doing the right thing by them. You also know in your heart that they're probably going to keep wanting to come back to you because they trust you and they know that you're going to really look out for them in the right way. So when you see people out there in the media who are having too much work done, really feel compassion for them. There's obviously a lot of factors involved, whether that's their baseline psychology of low self-worth and craving things that, really aren't serving them, versus an injector who's allowing that to happen. So it's like a Swiss cheese model, we call it in medicine, where you have multiple holes that align for something to fall through the cracks. And it happens more often than not. And it is a constant fear people have that they're going to look that way. But I sort of tell people that as long as they feel that they can trust, then things are going to be okay. But they also have to understand, the person that they're seeing, are they going to look out for them and do they have the right vibe? So a good thing that you could do as a patient, just as a little test, if you're not quite sure whether or not this injector is going to have your back and really be willing to say no if it's not going to serve you, think of a silly question. Think of a question that's going to really challenge them. Like, say I want lips like Angelina Jolie, and see what they say. If they say, sure, let's do it, it'll take me 5 minutes, red flag. But if they say, oh, not sure if that's going to look well, or I don't really think it's going to look the way you want it to, or they're going to start skewing you in a different direction, then they're probably looking out for you. So that's a really good thing that you can do as a patient to empower yourself to ask that right question so that you do feel like you're with someone who really has your back. Another thing that you can do is look at the injector. I mean, it sounds silly, but I often tell people that if your injector looks weird, you're going to look weird too. Do they look natural? Have they had work done? If so, what have they had done? Ask them. It's important for people to understand that because it shows you, are they someone who really says what they do? Do they practice what they preach? Because you've got to have someone who really understands what it's like and understands what the right thing is so that they can apply it to you. it's kind of like, seeing a personal trainer or something like that, and and they're really overweight, or they don't go through that lifestyle that they're trying to get you to. It's a double standard, which isn't fair, and they don't have empathy for you, because if they're not willing to sort of go deep themselves and correct those issues themselves, they can't help you. People can only go as deep with you as they've gone themselves. So really watching what people do and seeing that they are their own advertisement is a really powerful tool as well. So you can kind of seek that. And the same goes for people who are injectors as well. Are you having too many treatments? I mean, certainly treatments are very accessible to injectors, and treatments can be trendy. I mean, we spoke about in a previous episode as well that beauty trends are a thing, and it sometimes leads us down the garden path, but just because it's trendy, it doesn't mean it's necessarily good for you. And there's injectors and sponsored by different companies, and does that mean that they're more skewed in what they're going to offer you based on the company they're sponsored by? So ask them those questions as well. It can be really hard to kind of decipher, because the cosmetic medicine industry is fueled by, yes, superficiality, but also fueled a lot by income and money. And it shouldn't be that way, but it is. And so that's why we have these conversations, so that we understand why people go too far and what can be done in order to stop it from happening. Another reason people can go too far with cosmetic treatments is that they can get a little bit bored with maintenance. They can view maintenance as a little bit of stagnation. So you've had a treatment, you're looking good, let's maintain those results. However, if you want more, like you feel like maintenance isn't enough, you feel like you need to keep growing and working forwards, it can sort of lead them down that path of really wanting more. And that doesn't necessarily serve them, because how lovely is it that you have good results that are being maintained? That's what we all want. We don't want to get to the point where we're like, oh my God, you need a lot of stuff done now. And sometimes, people do expect crazy results when they've really had no treatments for a very long time. And that's a bit of managing expectations too. But kind of sort of seeing it as a bad thing that you're just maintaining. It's actually a wonderful thing. It means that your results are lasting. It means that you look really good for your age and people don't know why. So we need to embrace that and not think that that is a failure or somehow it doesn't mean you're growing. It really tells me that there is growth that you need to do internally if that's happening. It's stuff you have to work on the inside. Because if you're feeling like having maintenance cosmetic treatments is a bad thing, or it's not meaning that you're growing, you've stopped growing on the inside. So re-listen to the episode that we've done on self-worth. That really is a really core issue that a lot of people have, that when they start building that and getting to that point of really loving themselves, they realize that it's a beautiful thing to maintain, obviously, how they're expressing themselves on the outside, but also growing on the inside. Because growth and self-development can happen forever. Nothing is ever going to stop that from happening except for yourself. So think about it. If you feel like you have to keep having different treatments or more filler, say, or something like that to kind of keep going, leveling up, then why is that? Is it because there is something on the inside that you're missing? So good cosmetic procedures should really empower you to feel that you are the best version of yourself. They shouldn't make you feel like you're chasing something that is constantly unattainable. They should help you express your authentic self, and they should favor confidence and not change your identity. So we're all trying to build ourselves up to reflect how we feel on the inside to how we look on the outside. So seeing someone, as we've mentioned, who you can trust, asking lots of questions and testing your injector, you have the power to do that. And as an injector on the flip side, really understanding people and not having that fear that they're going to walk away and somehow that's going to be a failure on your part, because you know what you bring to the table. The right people will follow you. The right people will come to you. And if that means it takes a little bit longer, then do it the right way. Because if we try and shortcut anything, chances are we're going to have a bad outcome. Life isn't about shortcuts. It's about laying the correct foundations and slowly working towards a goal that we want and being happy in the now. Being happy in the now and having a vision for the future is really what is the key to driving yourself forward. So rather than waiting until you get a certain number of patients or certain amount of income to be happy now. You're doing something that you really love. That's a beautiful thing. And by doing that, putting that positive energy out there, the good things will keep coming to you. But that takes an element of faith. So everyone just really needs to have a lot of faith and a lot of trust that we're doing the right things and we're not trying to control situations we don't have control over. Because aging is scary. No one wants to age, and no one wants to look at themselves and go, oh my God, I don't recognize myself. That feels like a failure. But aging can also be beautiful. We can all embrace the fact that we are getting older, and it's a privilege to get to this point and have lots of growth and self-development and things like that, which are really great. Because when you're young, okay, you might have youth on your side, but how many of us look back to ourselves when we were younger and go, oh gosh, we made some bad decisions, or we reacted badly to certain situations? It's not a failure, it's just us being immature and not having life experiences yet. So you can have the best of all of the worlds. You can have good cosmetic treatments that maintain you beautifully. You can have self-development and learning to love yourself and express yourself in an authentic way. And you can have success as an injector and as a business owner in this industry and do it the right way, knowing that you can sleep at night and knowing you're doing the right thing by your patients, and they'll pick up on that too. People that know that you're trying to get them to do certain things because you want to sell a certain number of products or whatever, they'll pick up on that. And that is negative energy. And when that happens, inevitably, karma and negative energy will come back to you. So just think about that. But ultimately, we don't need to be scared of cosmetic treatments. Good cosmetic treatments are out there. Not everyone has to blow up like a balloon. There is a lot of noise and things out there that enable people to go to that, like we've discussed. But what it comes down to is just understanding that you don't have to go down that path because you have the power to make the right decisions. So that wraps up another episode of the All or Nothing podcast. If you have any questions about this episode, please email me at askdrheather@allor.co.nz. You can also check out my website, www.allor.co.nz. And you can listen to this podcast on Spotify, YouTube, and iHeartRadio. Stay tuned for the next episode where we're going to talk about bullying, in particular woman versus woman bullying, which I find is an interesting topic that a lot of people don't talk about. So we'll unpack some ideas and meaning behind it because I know a lot of you have experienced it, so we can all try and navigate it together.